So hi Megan, I'm a student in the massage therapy program and I'm going to be assessing you today. So to start, I'm just going to get you to point to the pain.
Right here.
Okay, so it's in your lateral shoulder. Is there any tenderness in that
Yes.
area? Okay, so some tissues in this area is your deltoid muscle right here, as well as some rotator cuff insertions. The temperature feels okay, normal, indicating that there isn't any inflammation. The tone feels like there might be a little bit of tension, indicating some muscle guarding. I'm also just going to palpate for some trigger points. Do you feel any referral pattern anywhere?
Nope.
Okay, perfect. So I haven't found any trigger points. So now we're going to be ruling out the joints above and below your shoulder. So to start, we're going to be doing your cervical spine. So I'm just going to get you to rotate your head to the right. And is there any pain there?
Nope.
Okay, so I'm just going to do a bit of overpressure. Perfect. And then rotation to the other way. Any pain?
Nope.
All right, overpressure. Perfect. Neck flexion. So I'm just going to get you to bring your chin to your chest. Any pain?
Nope.
Overpressure, which is normal. And then extension, just your head backwards. Any pain?
Nope.
Perfect. So I'm not going to be doing any overpressure in extension. So now we're going to be doing the elbow. So to start, I'll get you to do elbow flexion, so just like this. Any pain?
Nope.
Okay, so overpressure is normal. I'll get you to do extension, so just your arm out straight. Any pain?
Nope.
Pressure is normal. So supination, I'll get you to have your palm face upward. Any pain?
Nope.
Overpressure is normal. And then pronation, I'll have your palm facing downward. Any pain?
Nope.
All right. So overpressure is also normal. So the reason why we roll out the joints above and below is just to make sure that the pain is not coming from those areas. So your pain is not coming from your neck or your elbow, which is a good sign. So now we're going to be doing shoulder. So to start, I'm going to be doing shoulder flexion. So it's going to get you to bring your arms straight. And any pain?
Nope.
No? Okay, so it looks about 170 degrees, which is normal. Tissue stretch, which is also normal. For extension, I'm just going to get you to bring your arm backwards like this. Perfect. Any pain?
Nope.
Okay, so it's about 50 degrees, which is normal. And feel as tissue stretch, which is normal. So I'm going to get you to do adduction. So just bring your arm across your body like this. Any pain?
Nope.
Okay, so overpressure, tissue stretch, which is normal. Okay, so now we're going to be doing abduction. So I'm just going to get you to bring your arm out towards your side like this.
That's most painful.
That's painful? Okay, so that's about 90 degrees, which is limited. I'm just going to do a little bit of overpressure here. Okay, so that's tissue stretch, which is also normal. So for medial and lateral rotation, I'm going to get you on your back with your shoulder just off the table a bit. So for medial rotation, I'm going to get you to bring your arm downward. Okay, so that's about 80 degrees, which is normal. And feel as tissue stretch, which is also normal. For lateral rotation, I'll get you in a stop sign position. All right, any pain?
Nope.
Okay, so that's about 80 degrees, which is normal. And then tissue stretch. So to end, we're just going to be doing, I'm going to be moving into the range that was painful for you, which is abduction passively. So I'm just going to move your arm this, and are you experiencing any pain with that?
No.
Okay, perfect.
Okay, so the next thing that we're going to be doing is some resisted testing. So for this, I'm going to have you go through the same ranges that you did earlier, but I'm going to put some resistance for it. So first one I want you to do is just bring your arm up. Some resistance. Any pain with that?
No.
Okay, so that's strong. That's a grade 5 out of 5 and pain-free. Next one I want you to do is extension. Okay, and I'm going to resist that. Any pain?
Nope.
So that's strong, grade 5 out of 5, again, pain-free. Next I'm going to do is have you bring your arm across your chest like that. Resist there. Any pain?
Nope.
Okay, so again, strong, 5 out of 5 and pain-free. The next thing I'm going to do is have you on your back. We'll do those internal and external ones. Okay, arm out to the side. Now you're going to drop it in. Okay, any pain?
Nope.
So that's strong, grade 5 out of 5, pain-free. And you're going to drop it backwards. Okay, any pain?
Nope.
And that's strong. Again, 5 out of 5, pain-free. The last one we're going to do is the painful range that you had, so I'm going to have you sit back up. So we're going to go into the abduction. I'm going to resist that. Okay, and that's pretty pretty weak.
It's
Is that
painful.
painful? Okay,
Yeah.
so painful, and probably only about a grade 4 out of 5 because it was a little bit weak there. Okay, so the next thing that we're going to be doing is a joint mobilization to see if it could possibly be in the joint rather than the muscle. So I'm going to have you lie back on your back there. Okay, and I'm just going to stabilize here and just put some pressure down the joint. Just let me know if it recreates your symptoms at all. Okay, any pain? Nope. No? Okay. Okay, perfect. So now I'm going to do a length test. So for this one, I'm going to have you bring your arm across your chest there. I'm just going to do a length test of the deltoid muscle, which runs around here. See any pain with that? Nope. Okay, and that length looks really good as well. Perfect. And that's all. So now what we're going to be doing is our first orthopedic test. So for this one, I'm going to have you stand up. What it's called is the sulcus sign. So it's going to test for inferior, so downward stability of your shoulder joint. So what I'm going to do is pull here and see if it leaves a step at all there, okay, on your shoulder. Okay, so I pull. Okay, I'm not seeing a step. I'm going to do that one more time just to get a good result. Okay, again, no steps. So in that case, it's a negative test. A positive test would be if there was a little bit of a step indicating inferior instability or glenohumeral, so shoulder joint laxity. And that would be a positive test. But again, in this case, it's a negative test.
Okay, so next we're going to be doing our second orthopedic test, the empty can test. This empty can test tests for a possible supraspinatus tear. The supraspinatus muscle runs from the posterior aspect of the shoulder, inserts into the most lateral aspect of the shoulder. So what I'm going to get you to do is stand up. With your left arm, I'm going to get you to abduct it up to the side of your body here. And I'm going to resist here. And is there any pain with that?
A little bit, yeah.
Okay. For the second movement, I'm going to get you to bring your arm out in front of you, like you're emptying a can of water.
Yeah.
And I'm going to resist that again.
Okay.
And is there pain there?
There is pain, yeah.
And is it reproducing your primary complaint?
It is, yeah. That felt like
Okay, so I'm going to get you to do that again. So bring it in front of your body. And again, there's pain there?
Yeah, in the same spot, yeah.
Okay. So that is a positive result for a supraspinatus tear. Doesn't mean that you have a tear, but there's a possibility. Because there was pain and weakness, if it was not a supraspinatus tear positive, you wouldn't have any pain or weakness. Okay, now we're going to be going into a myotome test, so I can get you to just sit on the table. So myotome test tests for fatigable weakness of nerve involvement, whereas a muscle strength test tests for strength of a muscle. Okay. So we're going to be doing C4 nerve, so that's elevation of the shoulders. So I'm going to get you to elevate your shoulders. I'm going to resist that movement for 5 seconds.
Okay.
1, 2, 3, 4, 5. So it looks like you had no fatigable weakness, so it was strong there. Now we're going to be testing for a dermatome. Dermatome basically tests for any sensation loss with nerve involvement. So I'm going to be running my fingers down different parts of your arm. Just let me know if you lose me at all, okay?
Yep.
So I'm going to get you to look away. So I'm just going to bring your arm out here.
Yep.
Still feel me?
Yep.
Okay, so that's a negative result because you had no sensation loss. If there was a positive result, we do a detailed scan, but we don't need to do that. Overall, I think the clinical impression is you have a supraspinatus tear. Again, there's no certainty with that, so no need to worry. I believe this because you had a positive empty can test with pain and weakness. You had pain with abduction actively, and when we fired the muscle, you had weakness in a grade 4 with the resisted. So overall, we can do massage. We can massage the surrounding muscles to help with any guarding and increase range of motion of the shoulder. There's no contraindications today. If you'd like, you can see your doctor to play it safe. Again, that's all we have. Thank you.